For years, fentanyl has been discussed in the United States as a public health emergency. Hospitals, emergency responders, and local communities have dealt with its consequences daily. At the same time, law enforcement agencies treated it as a criminal problem, focusing on seizures, arrests, and trafficking routes. That framework is now being challenged. Recent statements attributed to President Donald Trump suggest a dramatic shift in how the fentanyl crisis may be officially defined, not only as a drug epidemic, but as a matter of national security. Specifically, the proposal to classify illegal fentanyl as a weapon of mass destruction signals a fundamental change in language, priorities, and policy direction. This shift is significant, not because of symbolism alone, but because of what such classifications have historically meant in American governance. Fentanyl is a synthetic opioid that is extremely potent even in microgram quantities. Its spread has reshaped the overdose crisis in the United States over the past decade, contributing to tens of thousands of deaths each year. Unlike traditional narcotics, fentanyl is inexpensive to manufacture, easy to transport, and difficult to detect. Initially, federal responses focused on treatment programs, border inspections, and international cooperation. These efforts continue today, but the scale of the crisis has led many policymakers to argue that existing approaches are insufficient. Labeling fentanyl as a weapon of mass destruction places it in a category normally reserved for threats capable of causing mass casualties and social destabilization. In U.S. legal and strategic doctrine, this category traditionally includes chemical, biological, nuclear, and radiological dangers. The implication is not subtle. It suggests that fentanyl is no longer viewed solely as a substance abused by individuals, but as a mechanism capable of undermining public safety on a national scale. Historically, the language used by governments matters. Definitions shape authority. When an issue is defined as a criminal matter, responsibility rests primarily with law enforcement and the judicial system. When it is defined as a public health crisis, responsibility shifts toward medical institutions and social services. When it is defined as a national security threat, the scope of response expands significantly. That expansion does not automatically imply military action. However, it does open the door to broader intelligence operations, financial surveillance, sanctions, and international pressure on supply networks. In other words, it changes how the state organizes power. The timing of this reframing is also notable. The fentanyl crisis has persisted despite years of enforcement and treatment initiatives. At the same time, public concern about border security, organized crime, and accountability has grown. By redefining fentanyl as a strategic threat, the issue moves closer to the center of national policy debates rather than remaining on the margins of health discussions. Supporters of this approach argue that it reflects reality. From their perspective, a substance that kills large numbers of people annually poses a threat comparable to other forms of mass harm. Critics, however, caution against the risks of escalation. They argue that focusing on security language may divert attention from addiction treatment, prevention, and socioeconomic causes that fuel demand. This tension lies at the heart of the debate now unfolding. The implications extend beyond U.S. borders. Canada has experienced a sharp rise in opioid-related deaths linked to synthetic drugs. European governments have warned about the increasing presence of fentanyl and similar substances in illicit markets. The United Kingdom has repeatedly emphasized the need for early containment before usage patterns mirror those seen in North America. If the United States formally elevates fentanyl to a national security threat, allies may face pressure to adopt parallel frameworks. This could result in tighter cross-border coordination, expanded intelligence sharing, and stricter controls on chemical precursors used in synthetic drug production. Such cooperation already exists to an extent. What may change is the intensity and prioritization. Another key issue raised by this reframing is responsibility across supply chains. Fentanyl production and distribution rely on complex international networks involving precursor chemicals, manufacturing facilities, transportation routes, and financial systems. Disrupting these networks requires cooperation between governments with different legal systems and political interests. By defining fentanyl as a strategic threat, the United States signals that it may seek broader tools to address these networks, including economic measures and diplomatic pressure. Whether this leads to effective disruption or increased geopolitical tension remains uncertain. There is also a domestic dimension that cannot be ignored. Communities affected by fentanyl often experience overlapping challenges: unemployment, inadequate healthcare access, and strained public services. A security-focused framework risks oversimplifying these realities if not accompanied by long-term investment in treatment and prevention. At the same time, families who have lost loved ones often express frustration that the crisis has not been treated with sufficient urgency. For them, stronger language represents recognition rather than exaggeration. Both perspectives coexist, and any policy response must navigate this balance carefully. What this moment ultimately represents is not a final decision, but a turning point in how the crisis is discussed. Language shapes policy pathways. Once an issue enters the realm of national security, it tends to remain there. The long-term consequences of this shift will depend on how it is implemented, how oversight is maintained, and whether enforcement is paired with meaningful public health strategies. The fentanyl crisis has already altered communities across North America. What is changing now is the official lens through which it is viewed. Rather than being treated as an isolated social problem, it is increasingly framed as a systemic threat with international dimensions. That reframing carries power and responsibility. The coming period will reveal whether this approach reduces harm or simply redefines it. What remains clear is that fentanyl is no longer being discussed as a secondary issue. It is moved to the center of national and international concern.